Speaker is Dr. Edward Chow. Dr. Chow is the director of the Chinese Community Healthcare Association. Dr. Chow?
Thank you, Larry. And I do want to commend Ted, first of all, and of course Fiona for actually stepping up and speaking about this very important public campaign that is going on. And I would do that also and congratulate everybody who has been working on this, because not only do I lead a medical group, but I've had the opportunity to be on actually all sides of what has become a full range campaign that involves the nonprofit sector along with the health department and the private sector, where this is one campaign in which in this city so many people have come together with the help and persuasion of Ted and Fiona to really reach out and create what we hope will be a hemp-free bee city. It's a campaign that's almost unprecedented because it began from the grassroots. And as a health commissioner, I know it didn't start in our department. And we're pleased that in our department we were able to create the environment in which our department now is committed to working on the Hep B campaign. And it didn't start simply at Chinese Hospital, even though 10 years ago we realized the advantages of trying to work on the Hep B problem. And in Chinese and San Francisco General, in fact, the studies, part of the studies that then had universal vaccination of the newborn were carried out here, which then convinced the powers that be on a national level that this will be one of the vaccines given to every newborn. So that, again, throughout the country, we'll have the opportunity to eradicate Hep B and its serious sequelae. But in our city here, where over a third of our population are Asian Americans, we must now reach out to those who didn't have that advantage of being able to be vaccinated at birth. We have a gap, therefore, and people who are coming from other parts of the world to help work to be sure that, as Fiona said, we can identify them, and we can identify them in two ways. If 1 out of every 10 is positive for chronic hepatitis, then for 1 out of every 10, we can today do something about that, avoid the sequelae, or capture something early enough to actually help ameliorate the problem. But there's 9 out of 10 that we can actually then vaccinate and have them avoid hepatitis B. And ultimately then, with the vaccination of the newborn and working with all of the people who are at high risk, and certainly in our city, with the compactness of an urban environment and in other urban cities with high Asian American population, it is best to then seek out everyone within that high risk group, within that kind of environment, so that we can eradicate out of those 9. Let me re-emphasize again that 80% of all liver cancer actually is related to hepatitis B. And if we then eliminate hepatitis B, we can eliminate the cancer. And for those who are chronic carriers, we can continue to follow, and with the new medicines we have today, we can then avoid the serious sequelae. Because early enough, our techniques now in helping keep viral loads down at the right times will then avoid the need to even hopefully get to a point where we would have to do a hepatectomy or a liver transplant. And it's very similar to what and how we control the HIV infections. So we can control that group of people so they never have to reach the serious sequelae and are able to continue to live useful, fruitful, and productive lives. Therefore, in order to reach this, we realize that it's necessary to inform our providers and our public. These types of public relations advertisements will do that. And it's a continuous message. It's not only one time, because people forget quite quickly. Even within our medical community, we need to remind people that we need to screen for people, and in this case, screening for hepatitis. Just last month, a report was released in the Journal of General Medicine on the Vietnamese population from UCSF studies on the Vietnamese population, part of, again, the early work that we have been doing here in San Francisco, pioneer work, which then, once again, even in 2007 and 8, showed that the Vietnamese population that they worked with were still unaware of what they were to do. And likewise, the providers were unaware. So once again, the campaign to reach both providers and the public, so that the providers know when an Asian American comes in, just like asking whether or not, what's your weight, what's your height, what's your BMI, we need to find out what was your status in terms of Hep B. Have you had your test? And if it's negative, have you had your vaccines? And if it's positive, how do we follow you? And how do we then help you stay healthy? So those are the challenges we have. And for all of those who have worked on this next campaign, it's going to carry us into that next level of reaching another group of people so that our public and private hospitals that have volunteered to do the testing, and all the organizations that have all agreed that these are to be not only recognized as appropriate medical diagnostic studies, but even the treatment now is to be covered under all plans, will be able to reach and have access to this care. No longer do we have to say that this isn't a travel vaccine. They know. The public is, our national organizations have already made these as basically guidelines for the Asian Pacific Islander population. We now must get the word out, continue to get the word out, and I really congratulate everybody for all their hard work, and thank you so much on behalf of, I think, all of our people here in San Francisco. Thank you.